Let's talk for a few minutes about a couple different methods of treatment. What happens when somebody does have a disorder or some sort of abnormal behavior? How do they get treatment and what type of treatment? One of the most common forms of treatment today is medical therapy. And the thing you have to understand here is that if you're going to treat something with medicine or with some sort of drugs, well, then the assumption has to be that there is some sort of a biological condition that's causing you to have that type of behavior. So there must be something wrong with either the way that the brain is functioning or something with the body. There has to be some kind of a physical cause for the problem. So that's the whole idea with medical therapy. When we talk about drug therapy and we talk about drugs that act on the mind, we refer to those as psychotropic drugs. Those are things like antidepressants, anti-anxiety medications, antipsychotic meds, all of that. Now, one thing that psychiatrists and people have to be aware of is that long-term use of those types of medicines, those types of drugs, can cause issues. Tardive dyskinesia. That is an issue where a lot of times some people will have involuntary muscles, or movements rather, of facial muscles, things like that, due to long-term use of antipsychotic medications. So, one other thing that you have to understand about drug therapy is that the drugs will treat the symptoms of the problem. So, for example, they may help control moods, they may help control certain types of behavior, but they do not necessarily cure the problem. They typically do not do that. It's not like if you, have some kind of sickness and your doctor prescribes you penicillin or something like that and it cures you. This is not the same thing. It will treat the symptoms, but it's not going to provide a cure. Now, what other types of medical therapy are there? Well, one is shock therapy. And shock therapy has changed dramatically over the years. If you would have talked about shock therapy back in the 1950s or prior, you definitely didn't want to have that done. That was, not a very good method to use. But shock therapy nowadays, it's rarely used, but when it is used, most of the time it's for very severe depression. Patients who have severe depression have responded quite nicely, many of them anyway, to shock therapy. What they do now is they localize just very small amounts of shock to various parts of the brain. Now, it still can cause sometimes convulsions, it can cause short-term memory loss, things like that, but what they found is that the brain, and it's weird because they don't know exactly why this happens, but the brain will respond to the shock therapy occasionally, and the person will not be nearly as depressed. I have seen interviews with people who have undergone this. I know one person in particular, and it worked perfect for them, but I've seen other interviews with people who have this done, and some people have it done multiple times. For example, one patient was talking about how he would undergo shock therapy, and he actually looked forward to it because he knew he was going to feel so much better after the treatments were done. And then it might last 5, 6, 7, 8 months, but down the road at some point in time he would start going into a depression again. And he had multiple cases of shock therapy, and he actually looked forward to them. So it is one thing that does tend to work fairly effectively nowadays. Now, the last resort in any case would be some sort of surgery. Most of the time, surgery today is only going to be done if they find some sort of tumor, or if there's some sort of like pressure resulting from, some kind of abnormality in the brain. So typically the surgery is the last resort. Now, you may hear about lobotomies. People talk about those a lot still today. They're essentially not done anymore, but years ago, 1930s, 40s, 50s, and 60s, lobotomies were done. I won't say extremely often, but more often than they probably should have been. A lobotomy typical scenario was that they would drill a hole in a person's skull, and then they would go down with an instrument, and they would essentially swish around an instrument to destroy some of the connections, and usually in the frontal lobes, to try and help change a person's personality. It was never extremely scientific in the way they did it, but that's probably the reason that we don't do it anymore. Now, that's medical therapy. There's another type of therapy that I'd like to talk about for a few minutes, and that's psychotherapy. And psychotherapy is kind of an umbrella term. It's a big term that encompasses a variety of different types of psychotherapy. Psychotherapy basically means talking therapies. You have probably, when you've been down about something and your parents or friends come up and say, hey, you need to just talk to somebody about it, it'll make you feel better. Well, that's exactly what this is. Psychotherapy is talking therapies. Now, there's different ways to go about this, all right? For example, psychoanalysis is one form of talking therapy. Psychoanalysis is based on Freud's psychodynamic theory, and the idea here, or the assumption, is that you are being troubled by something down deep in your unconscious mind. And something way back in your past or some kind of a traumatic memory is the cause of your problem. So what they do is they talk and they talk and they talk, trying to get down to whatever's in the unconscious and let that out. The goal of psychoanalysis is catharsis. And catharsis is the release of all those built up inhibitions and emotions and just bad feelings that you've got down deep in you. So that's the goal, is to have a cathartic event, to be able to let that stuff out. Now, we've already talked many times about how do you get down to the unconscious mind, and you do so through things like free association, dream interpretation, things of that nature. Now, one difference that we're going to note between this form of psychotherapy and another one that we'll cover here in a minute is that psychoanalysis is very much doctor-driven. So the therapist, whoever the therapist is, they are going to be the ones that direct the therapy session. They're going to be the ones who challenge you to talk about a variety of things. And down here at the bottom of this slide, resistance, if you tend to resist talking about a particular issue, they're going to go after it. Okay, that therapist is going to try and poke and prod and keep going until they can eventually find out why is it that you're resisting talking about whatever the issue is, because they feel like that's one of the things that's down deep in the unconscious that they need to get out. Now, that's psychoanalysis. A different form of psychotherapy, again a talking therapy, is what we call client-centered therapy. Now, client-centered therapy is based on the ideas and the beliefs of Carl Rogers. And if you remember, Carl Rogers was a humanistic theorist, and Carl Rogers believed that you're striving, your entire life you're striving to reach your potential. You're trying to self-actualize. So with that in mind, the assumption here is that you're having issues, you're having problems because you are not on the right path towards self-actualization. When we talked about, for example, the real self and the ideal self, the idea being that your real self is striving to get to the ideal self, something's gone wrong. Something has happened in your environment. Who knows what it might be, but something's caused you to get off course. You need somebody who can help you to get back in the right direction. Now, who's going to help you to get back in the right direction? That's the therapist. That's the therapist's job. The therapist then is not considered an expert. They're considered more of a competent friend. They're a friend who knows how to help you to find your own way back towards self-actualization. So if you tend to resist talking about something, they're not going to poke and prod. They might want to, but they're not going to. They're in many ways, they tend to be very reflective. So, for example, if they'll be very good listeners, they'll listen to what you're saying, but then sometimes they will simply restate what they hear you saying so that you can hear it in a different way. And the idea here is that when you hear them saying the same thing, that's going to allow you to kind of reflect and to contemplate and think, okay, what should I do? And you're going to figure out on your own how to best help you. Okay? But that's the goal of client-centered therapy. Now, we've talked about the idea of unconditional positive regard. The therapist always treats the client with respect and with unconditional positive regard. They're going to support the client no matter what, and they're going to make sure that the client knows that they're a worthy person, that they deserve to be able to find their way, into a better lifestyle and a better ability to live a happy life. Now, the therapist is also going to practice empathy. So they're going to try to share the feelings of the client so that, again, they can kind of help that person through. So what we've talked about is forms of medical therapy. That's treating things, with drugs for the most part, or potentially shock therapy or surgery. And then we've also talked about different types of talking therapies.